The goal of this video is to talk to you about pelvic organ prolapse. So what is pelvic organ prolapse? Pelvic organ prolapse is when your pelvic organs, so the uterus, the vagina, the bladder, or the rectum, are no longer well supported and they bulge into the vagina or outside of the vagina. You can think of it as a hernia or a bulge in the vagina. This happens because there's a lack of support to these organs. The support is weak or damaged. So sometimes we see the uterus coming down, sometimes the vagina, and both the bladder and the rectum can herniate into the vagina. You can have this happen to one of the organs or all of the organs. Prolapse frequently is not appreciated or noticed when the organs are still inside the vagina. You often feel symptoms when the bulge is just inside the opening or lower. We stage prolapse, and there are 4 different stages. So stage 0 means that there's no prolapse whatsoever. Stage 4 is when everything is out and really as far out as it can be. Stage 2, which is when the prolapse is within a centimeter of the opening of the vagina, is when we first start seeing patients, when people come in because they're having symptoms. What are the risk factors for prolapse? So there are some genetic factors that make prolapse more common, and sometimes we see whole families of women that have prolapse. These women just have a weaker type of connective tissue that makes it more likely that they're going to have herniations and this lack of support. It's also more common in smokers. Women who have had injuries to their pelvic floors are more likely to have prolapse, and this is most commonly associated with a vaginal delivery, and even more likely if that vaginal delivery has been traumatic, so associated with a 3rd or 4th degree tear, with an instrument delivery, or with a very long labor. We also see it in women who've had trauma to the pelvis, fractures, or radiation. Prolapse is also more likely in women who have chronic constipation and straining or chronic coughing. It's more common in obese women. Obese women are 40 to 70% more likely to have pelvic organ prolapse. We see it more commonly in menopausal women, although premenopausal women can absolutely have a prolapse. And it's also more common in certain nerve and muscle diseases. Prolapse can lead to a lot of different symptoms. The most common symptoms are feeling like there's a bulge coming out of the vagina or like you're sitting on a ball of tissue. Prolapse can lead to a sensation of fullness or heaviness, but there are lots of conditions that can cause that as well. And prolapse can also impact how the bladder and bowel function. It can lead to leaking in some women of urine or of stool, and it can also lead to trouble emptying, both of urine and of stool. Prolapse is not commonly discussed, but it is very common. About 1 in 8 women will end up with a surgery for prolapse during their lifetime. The best way to avoid prolapse is to avoid the risk factors that we just talked about. So don't smoke, avoid constipation. If you have a chronic cough or asthma, you want to have that treated. You want to maintain a normal weight and a strong core. And all of these things will help you avoid a prolapse. We treat prolapse when you have bothersome symptoms. And so you have to come to us and tell us that it's bothering you. And then we can talk about the different ways that it can be treated. And there are both conservative ways, so non-surgical ways, and surgical ways.